Reducing the amount of violence that takes place within Oklahoma's jails and prisons is the focus of this week's in-depth discussion. Making them safer for both inmates and personnel is a worthy goal, and that served as the starting point for moderator Reese Wetzel and his panel of guests.
Rich, thank you. Today we have three guests here that can kind of give us some more information on this important topic regarding health amongst people who are incarcerated and also guards as well. Today we have Brianna Bailey from The Frontier. She is a reporter with The Frontier. We have Damian Shade, who's the Executive Director for Oklahomans for Criminal Justice Reform. And we have Jasmine Sankofa, Policy and Research Manager for Criminal Justice Reform at Ford.us. How's everyone doing today?
Doing well.
Well, I thank you guys for being here. First off, I want to start with Brianna. Overall, where does Oklahoma rank nationally regarding jail violence or jail deaths? Are we unfortunately a top 10 state in this category?
We are a top 10 state, and a big problem is you have people going into jails, and oftentimes they're experiencing a mental health crisis. They're experiencing the long-term effects of chronic substance use. And they have a lot of chronic physical health problems as well. And the jails, a lot of them are just not equipped to handle those needs of people with really high needs in those areas.
Yeah, and Damian, that brings up a good point. You know, we see a lot of topics around the Oklahoma County Detention Center, but it's not just that one jail. It's jails across Oklahoma. Why is this becoming such a widespread issue across our state? And is it just a problem that really is in Oklahoma, or do other states see this kind of, jail deaths like we do?
Well, thank you so much for covering this important topic. I think this is really a public health conversation more than anything else. So in Oklahoma, we have one of the least resourced mental health systems in the nation. The Oklahoma Department of Mental Health and Substance Use Services estimates that for every 3 Oklahomans who need significant substance use and mental health treatment, right now our current funding model only allows us to help 1 of those folks. So 2 in 3 Oklahomans who need significant mental health or addiction treatment can't get it. So for many of these individuals that Brianna's talking about, the first time they ever have an interaction with addiction treatment, with cognitive behavioral therapy, with any of those pieces might be in a state prison facility after they leave the county jail. County jails are not equipped to provide those types of resources and services to people. So we have a system where, because we're not paying for prevention on the front end, we're forced to pay for it on the other end. And unfortunately, we see crime victims, right? We see business community leaders being upset by the amount of folks that they see experiencing homelessness in their neighborhoods and having co-occurring mental health and addiction. By not treating this as a public health crisis, we've made the problems of crime and incarceration worse.
Yeah, and you say it's a public health crisis. Can you elaborate a little more on what you mean by that?
Absolutely. So when you're talking about Oklahoma's incarceration crisis, you are talking largely about people who have experienced co-occurring mental illness that was undiagnosed and untreated, some type of trauma, with Oklahoma having the highest rate of people experiencing what they called adverse childhood experiences in the nation, with no trauma-informed care as a standard thing in our schools, and especially amongst our young people in those critical ages when they begin aging into what people call criminogenic or crime-like behavior. It is all of those lacks of investments that's led us here. Making the system worse is the fact that in 2020, we had 5 people in the state who could do competency evaluations on defendants who might be judged incompetent for trial.
You said 5 people.
5
right?
people in
5
the state.
People. Wow.
Now we have 3. The
So
situation is
we
we've
haven't
lost
even grown.
people.
Wow.
Yeah. And so we are looking at the Oklahoma Forensic Center, which is the one place in the state of Oklahoma, in Veneta. One of the good pieces is we're looking at investing in 80 more beds to deal with some of that backlog of people who cannot get evaluations. Those people are just sitting in jail. waiting for a bed somewhere in an outpatient or inpatient facility, waiting for a bed in Veneta, and those people are decompensating, so sometimes they're hurting themselves in jails and having to be put in hospitals. It's really an unsustainable situation that our lawmakers and leaders have to address.
Yeah, I mean, just to say that we lost, I was not expecting. I was hoping you were going to say, we gained some people. But Jasmine, that kind of brings me to you here real quick. So when we look at reform for jail conditions and kind of including more mental health stability, it's not just for people who are incarcerated. Should we also be looking for, people who are staffing there having mental health treatment as well?
I think what's been important and what I appreciate so far in this conversation is this focus on not creating better jails, but on how do we create safer communities? How do we support people in their communities so that they're not funneled into the jails because of a mental health crisis, because they're struggling with poverty, because of a substance use disorder. So I think it's important in grounding this conversation around how do we support people, how do we invest in those services in the community so that people have the support necessary to where they're not then transferred into the jail system and there for days, weeks, months, and sometimes a year or more without the supports that they need to thrive. And instead, jails are destabilizing in and of themselves and have grave consequences. As was first talked about in terms of Oklahoma's standing nationally, when we look at jail mortality, there was a report done a few years ago that found that Oklahoma had the second highest jail mortality rate in the country. And this high mortality rate was really driven by Oklahoma County's jails and the deaths in custody there. In most recent years, we've seen more and not less deaths in custody. So there's obviously a crisis, as Damien was mentioning, around mental health and the support infrastructure that is truly lacking in Oklahoma, that isn't supporting everyday Oklahomans and preventing the incarceration crisis that we've been seeing. On any given day in Oklahoma, there's 9,000 people who are detained in local jails. And over 2/3 of those people statewide, that's 70%, have not been convicted of a crime. And that number rises up to 85% when looking at Oklahoma County. So that means a vast majority of people are funneled into the jails, have not been convicted of a crime, aren't getting any of their mental health and substance use needs and trauma informed care while in the jails, and are at risk of exposure to terrible conditions of confinement and even death. So I think what's important in thinking about, the next steps and being able to support people in the community is really not using jails as a place to institutionalize and warehouse people with mental health conditions, people struggling with substance use disorders, and folks living in poverty. But that's exactly what they're used for now.
Yeah.
We can invest more in community-based treatment and social services so that people have the support necessary to thrive.
That's, interesting point is investing in the community, and kind of I want to go back to Brianna here and talk about, we're talking about Oklahoma County and Oklahoma City. Well, the U.S. Department of Justice has said that they are now investigating the Oklahoma City Police Department due to some of the conditions or how they've been treating people who have made calls for mental health crises. What sparked this investigation, and is that kind of what we're looking at with how one of the first steps in trying to figure out what the next step is to make this process better?
Well, I think it's a statewide problem, and the DOJ is also investigating some of the state policies on how we handle care for mentally ill people, and how those calls come into the 911 system, how police respond to them. What we have seen statewide and also in Oklahoma County is that police officers respond to these calls for a person having a mental health crisis. In Oklahoma, a police officer can temporarily detain a person and take them to a hospital for a mental health evaluation. But that takes a lot of time for a police officer to do. They're in an ER waiting with a person for hours. There might not be any mental health beds available for a person, even if they are determined to be having a mental health crisis and they need to be admitted to a mental health facility. And a lot of times what happens on these calls, and I've written about cases where this has happened, where the person ends up getting arrested on a very minor charge. You know, maybe they kicked the police officer, or maybe a family member calls the police and says, my daughter's has bipolar disorder, and she's, in my house and she won't leave, and I need you to come get her. When what they're trying to do is get that person into treatment, because the family doesn't have any other means of doing that. They call the cops. The cops say, well, all I can do is arrest the person for trespassing. Wow. So a lot of times those people who are having mental health crises, where they're supposed to be, or should be ending up in a mental health facility getting treatment, they end up in jail.
So it's being looked at as more of a legal issue instead of a humanity issue. It's almost like, whoever's, having that crisis is not being seen as someone that is struggling with their mental health. They're just seen as someone almost who is kind of stigmatized by the mental health discussion. Which kind of brings me into what I want to talk with you, Damien. We were talking before, it's not just mental health, it's public health in general. There's a lot of instances where, someone might be in a jail and they are struggling with a health condition that's not treated. So are there even checks going on when they get into the jail at first? Are there health checks, mental health screenings? How is that process?
Unfortunately, that process is a hodgepodge in Oklahoma. There's 77 counties, most of which have county jails, and each of them has a pretty different public health and mental health infrastructure, some of which in Oklahoma County and Tulsa County, the two largest counties, you see a diversion infrastructure with providers that are often attached to the jail. In Tulsa, where I live, folks like Family and Children's Services and a new diversion hub that exists. In Oklahoma County, you have the diversion hub and other providers that are doing some front-end services. But in the 50 plus rural counties in this state, there are so few resources. One of the things that we need to talk about in this conversation for the public health and mental health components of this is that voters voted more than 6 years ago to invest more money in mental health, behavioral health, and substance use treatment for counties to begin managing these problems without just resorting to jails as the front-end responder for these crisis and public health problems. That was the 781 funding. This year we have legislation that is in front of the state legislature that could actually bring that money, millions and millions of dollars, to counties to help deal with some of these issues. You have 1 in 12 Oklahoma inmates has hepatitis C. You have you have chronic illness like diabetes and other significant issues that are really taking people's lives in Oklahoma jails and prisons. And when you talk about that jail death number, half of those jail deaths in the 2009 to 2019 report that was referenced earlier, half of those were for public health issues that were not dealt with. People who languished in jail with treatable diseases who died because they did not get the treatment and did not get the care they needed.
Yeah, I mean, that's something that I kind of want to jump in with Jasmine here. So it's, we're talking about people who are in jail, and they might be looked at as, well, if they're dying in jail, they're in jail. Some people might think that, but it's still a person that is in prison. How do we break the stigma around that, even though they're in jail, they're still a human being, and how do we focus on making sure that they're taken care of as well?
Yeah, it's important to always center people's humanity. And, I appreciate for most of this conversation too, we've been trying to use people-centered, people-first language during this conversation in reference to people who are incarcerated or formerly incarcerated. So calling them people instead of other words. But I think it's really important to think about the fact that jails are worsening people's mental health conditions, their physical health conditions. In the fall forward, we released a report called Turning the Page, Oklahoma's Criminal Justice Reform Story. And in that report, we include tons of data and stories about the progress that Oklahoma has made in criminal justice reform over the last 5 or 6 years, and also all of the work that needs to be done. And some of the stories we heard was one woman who was incarcerated at the Oklahoma County Jail, and she got a staph infection while at the jail. She wasn't given any treatment and had to have her finger partially amputated, right? So not only are jails exacerbating or worsening people's pre-existing conditions, but the unsanitary conditions that are there are creating conditions for people. And so I think it's really important that we're ensuring that these jails, which oftentimes people are going to jail for very minor things and are there, as I mentioned, the vast majority of people have not even been convicted of a crime. These are people who are legally innocent for the most part. They have not been proven guilty. A significant number of cases are dismissed, ultimately dismissed. A lot of people end up getting probation or some other kind of form of alternative to incarceration. So the reality is a lot of times jail is used or arrests are used in response to mental health crises, as Damien has mentioned and Brianna was touching on as well. Yeah. The issue is that the system relies on police to be those key first responders in every situation, including when people are undergoing a mental health crisis, that only furthers someone's mental health crisis in that moment.
We're running out of time here, and you bring up some great points, so I want to thank you, Jasmine, for everything that you have brought to this panel and the insight. I want to thank Damien as well, and Brianna. You guys have brought just great information to Oklahomans to figure out more about what goes on inside these jails. So thank you all for being here.
Thank you.